Okay, everybody, we are moving on to our week 6 lecture, lymphatics and the immune system. So this is our last lecture for this unit. So this upcoming test will comprise of the heart, the circulatory system, and this last one, the lymphatics and immune system. Okay, so our lymphatic system is very closely related to our circulatory system. So lymph is the plasma or the fluid portion of blood that ends up being left in the tissues after our capillaries filter all the nutrients and waste out. So our lymph is how we partly recycle fluid from the body back to the heart. Our lymphatic system, as you can guess based on the title of our lecture, also has a very large role in our immune response. So our lymph does not actually circulate. It's only propelled in one direction, and it eventually empties into our large veins. But in a way, our blood gets cleaned by our lymph nodes and lymph system along the way back to the heart. So we have a lot of white blood cells that are going to get rid of foreign material and bacteria and viruses and things that are not supposed to be in our bloodstream prior to getting back to the heart and recirculating it. So if you looked at a map or a layout of the lymphatic system, you could almost lay it right over top of all of our veins because they kind of run hand in hand with our venous system. Okay, so the lymphatic drainage itself, so you can see the two colors on the body here. So this purplish gray color is what portion of the body is drained by our right lymphatic duct. So our right lymphatic duct here in this zoomed in view, this ends up branching all the way out through our right arm and then up into our right side of our neck and our head to drain the lymph and plasma from that area. And so that ends up emptying back into the right subclavian vein prior to the superior vena cava. And then you'll see on the left side of the body and the whole entire lower half of the body, that is drained by our thoracic duct. So the thoracic duct is on the left side of the body. So again, this is going to drain into the left subclavian vein and then the right subclavian vein. So you see our left side does a lot more of the body. It's the whole left half of the upper body and left arm, as well as the entire lower body. So all of our lymph vessels, just like we talked about in the circulatory chapter, we have veins and then venules and then capillaries. We have arteries and then arterioles and then capillaries. Our lymph vessels kind of follow that same branch out. So we have little tiny lymph vessels that extend all the way into the tissues, and they get larger as they travel back to their duct on the right side or the thoracic duct side. So along the way, you'll see these little dots or nodes within our lymphatic system in our lymph vessels. And so those nodes are kind of our checkpoints along the way that are going to help clean that blood before it makes it all the way back to the heart. Oops, hold on, guys. There we go. Okay, so this picture here shows us a map of our lymphatic vessels as well as the different tissues involved in our lymphatic system. So some important lymph tissues are our adenoids, which are found kind of right near our nasal cavities. Our tonsils are part of our lymphatic system. They're made of lymph tissue. Our thymus gland is a super important lymph organ, and we'll talk about its function here a little bit more. And then our spleen is also a really important lymphatic organ. So our spleen's job is to help clean the blood, just like the rest of our lymphatic system. And our spleen also is a giant storage center for extra red blood cells. So you'll see all these different regions have their own nodes. So they're not all labeled here, but you can see a few of them, like the inguinal nodes in the groin, the popliteal nodes in the posterior knee. You would have an axillary node in the armpit, You see our cervical node up here in the neck. So all over, we have these vessels spreading out, and we have these nodes that are going to contain white blood cells to defend and clean the blood. One other thing I want to point out here that you'll see in a future chapter possibly is these Peyer's patches. And so Peyer's patches are little tiny patches of lymphatic tissue that are found in our small intestine. So that's what that's pointing to with that Peyer's patch. They highlight bone marrow on here as well, because this is where some of our white blood cells get their start, is in the bone marrow. So just like our veins, the lymphatic system does not have a big pressure to it. It only flows one direction. So you'll see they have these little valves that prevent backflow. And then they have a couple other unique features that help them stay tightly packed. And so you'll see in this diagram what they're showing is that in our capillary, the fluid's flowing out. And then we have this collector portion of our lymphatic vessel that is going to funnel that plasma into our lymph system. Okay, here's just a few terms associated with our lymphatic system. So go ahead and take a second, pause the video, and use your new word list to see if you can define all of these words. When you've finished defining your words, go ahead and start the video again, and we'll go on to the next slide. Okay, if you have all your words down, great. If not, pause the video because I'm going to go on to the answers. So here are your answers on this slide. Let's go back to our previous slide and go through it together. So an adenoma. So oma, we've seen plenty of times. That is our suffix for a tumor. And then our combining form aden, or our root aden, is going to be a gland. So that's going to be a tumor of a gland. So an adenoma. Lymphostasis. So stasis means to stop. Lymph is our root for lymph. So lymphostasis would be stopping of lymphatic flow, is what that would end up translating to. Lymphocyte, this should be an easy one. Cyte, we've seen a lot of times. That's a cell. And then lymph stands for lymph tissue. So this is going to be a lymphatic cell, some type of lymphatic cell. Thymomegaly. Megaly is our suffix for enlargement. And then THYM, thyme, that's our new root for the thymus gland. So thymomegaly is going to be an enlarged thymus gland. Lymphoid. Oid is our suffix for resembling. Lymph, we said, is our root for lymph. So resembling lymph tissue would be lymphoid. The thymocyte, that's going to be a thymus cell. In this case, it'll be a precursor to a T cell. We'll talk about what those are. Lymphangiocentesis, a little bit of a longer one. So we'll start with the suffix like usual. Centesis is going to mean surgical puncture. We're typically going to use that suffix when we're talking about some kind of puncture to drain something. So a lymphangiocentesis is a surgical puncture of a lymph vessel. So angio is vessel, lymph is lymph. So a surgical puncture of a lymph vessel. Chemotaxis. So this is going to be the term we use. Chem is chemical, taxis is movement. So this is going to be the term we use for the movement of white blood cells. So white blood cells, some of them, when they're activated, they release chemicals that attract other white blood cells. The movement of those white blood cells to that chemical attraction is known as chemotaxis. And then last but not least, we have lymphadenitis. So itis is our inflammation. That's our suffix there. And then lymph for lymph and aden for gland. So inflammation of a lymph gland. So here they are all here. So there's that kind of showing a cell moving. That's chemotaxis. They're gonna move towards that chemical attraction. And so just to point out here, our word there was lymphocyte. So our two types of lymphocytes are B and T cells. We'll talk about those a little bit. Okay, so our immune system is made up of multiple portions and responses. So this again highlights some of the organs of the immune system. So again, you see your tonsils and adenoids, the thymus gland, our spleen, the Peyer's patches. Your appendix is technically a part of your immune system, although it doesn't perform a super vital function. And so, of course, our immune system's primary job is to defend us against abnormal cells and foreign substances that are not supposed to be in the body. So we have many different tissues throughout the body that's involved in this because we need to defend the entire body. So we need to spread this out throughout our entire system. So when we talk about the immune system, we break it down into a couple of different categories. So this, you don't necessarily need to memorize the entire thing, but if you do, it's a great starting point in terms of understanding the organization of our immune system. So we're going to talk a little bit about innate immunity versus adaptive immunity. And you see my other labels here of non-specific and specific. And so we'll talk about why those go hand in hand. So our innate immunity, innate means something that you're born with. So innate immunity is going to be something that we were born with. So this could be physical barriers such as our skin, our mucous membranes, saliva, actions like urinating and tears that help wash away substances, and stuff like our stomach acid. So all of these physical barriers are trying to stop an infection or a foreign cell from entering the body. The other half of our innate immunity is going to be our blood-borne innate immunity. So some of this stuff we're going to get kind of passed down via genetics and from our mother in the womb. So we have this complement cascade and alternative pathway. That's just kind of that's just natural to the body. And then we have these phagocytes, which are a special type of white blood cell that can eat or digest material. So they don't necessarily care exactly what type of foreign material it is. If it's not supposed to be there, they're going to eat it. So that's our innate and non-specific immunity. So both these blood-borne and physical barriers, they don't necessarily care what the foreign material is or why they're being activated or utilized. They just naturally do their job. On the other hand, adaptive immunity is quite specific. So this is kind of the specialized part of our immune system. So we have B cells and T cells. So B cells are what we think about when you think of immunity most often. So when you first get exposed to an antigen, which would be some type of foreign material or something that your body is going to react to. So the first time you get exposed to an antigen, your B cell is going to recognize that antigen. It's going to then produce cells that recognize this antigen. So it's going to produce antibodies. So antibodies and its antigen go hand in hand. They match up with one another. So when an antigen is encountered, the antibodies for that antigen recognize it. That starts this cascade so that we know how we're supposed to get rid of. We also make these memory B cells so that if we come into exposure with this antigen again, we can produce antibodies more quickly to attack it again. Our T cells go into a few different categories, which you don't need to necessarily know. But the end result is going to be the destruction of a body cell that is infected or a foreign cell itself. But these are going to be specific or recognize specific types of cells. So innate immunity tends to be our initial response, or how we initially and quickly try to prevent an invader or foreign substance, whereas our adaptive immunity is going to be a little bit of our slower response, but it is going to be very specific and specialized to get rid of whatever foreign substance is in the body. Okay, one other type of immunity that we'll talk about is acquired immunity. So that just means immunity that you're going to develop throughout your lifetime. So we break this into a few different categories. So the first two kind of big overarching categories are going to be active immunity and passive immunity. What makes something active immunity means that your body is actively going to make antibodies to respond to an antigen or a foreign material. So this can happen both naturally and artificially. So naturally is if we're exposed to a sickness or a bacteria or a virus, some kind of infection, our body is then going to develop antibodies in response to whatever material is causing that infection. That's natural active immunity. Now, artificial active is something like a vaccination, where it's not going to be naturally encountered. It's artificial that we're putting this vaccine into our bodies, but our body is still going to actively make antibodies in response to whatever was in that vaccination. So it's still active immunity. So that's artificial active immunity. So passive immunity, our body is going to receive antibodies. They're not actually going to create them. So this is natural passive. So that could be antibodies received from the mother. This can occur through breast milk, and this can also occur through blood mixing during childbirth. Artificial passive immunity is going to be something like antibodies received from a medicine that mimics them, from some kind of injection, or if you get a blood infusion, the antibodies contained in that blood will be passed on to you. So active, we are creating antibodies. Passive, we are receiving antibodies, and each have a natural and artificial category. I know that's not so straightforward. Okay, so this just gives a little bit of a timeline of how our innate and our adaptive immunity responds. So as we said, our innate immunity, or our non-specific immunity, is going to be the quicker response. So these are some examples of our white blood cells that are going to be phagocytes that are going to be either in the tissue or attracted to the tissue where the infection is happening to try to start the inflammatory process. They might start the process of a fever to try to get rid of foreign material, or they're going to try to digest the foreign material. So that happens within hours. Over days, our B cells are going to recognize the antigen or invader and create plasma cells and antibodies to fight it. And then our T cells are also going to specialize to fight off whatever is causing the infection or sickness. That happens within a week time frame. Everything is working. Okay, I know I've warned you guys a couple times about some of our similar words. So here's a group of very similar words. So make sure on your tests you're really paying attention to exactly what you're reading. So go ahead, pause the video, and define each pair, or our group of three down here, and then go ahead and start the video back up when you're ready to review. Okay, so let's go ahead and go over them. So hemostasis versus homeostasis. So our suffix stasis in both words is going to mean to stop. So in this case, it comes down to what is in front of our suffix that makes these different. So heme is for blood. So hemostasis is going to be stopping blood or a blood clot. And then homeostasis is our maintaining of the equilibrium or balance within the body's internal environment. Induration versus inflammation. Both of these are on the additional terms portion of your list this week. So an induration is going to be a pretty firm, raised, hard, a little bit hardened red piece of tissue. Sometimes can happen from continued swelling over time. And then inflammation is going to be one of our innate immune responses. It's going to be the increase in blood flow to an area, the heat, swelling, that kind of response that we get when we have an injury or an infection. Okay, hypoxia versus hypoxemia. So these are just a slight difference. So you see hypo and ox are both shared in these words. So our difference is just our IA ending and EMIA ending here. So emia means blood condition. Hypo is going to be not enough. Ox is going to be oxygen. So hypoxemia is a condition of the blood of not having enough oxygen. So not enough oxygen in the bloodstream. Versus hypoxia is just generally not enough oxygen. So hypoxemia is a bit more specific. Okay, interstitial versus intracellular. So this one, the main breakdown here is the fact that we have intra versus inter. So inter is going to be in between. So interstitial, something like interstitial fluid, is going to be the fluid between tissues. So inter, between. Intra is going to be within. So intracellular would be within the cell. So inter, between, intra, within. All right, a lymphocyte versus a leukocyte. So a lymphocyte is going to be a lymph cell. Remember, this is going to be our B and T cells. A leukocyte is our white blood cells. So cyte tells us they're both a cell. This one's a lymphocyte versus a leukocyte. So lymph versus white. Thrombocyte versus a thymocyte. So again, our suffix cyte tells us they're both cells. Our thromb root is for a thrombus or a platelet. So this is going to be a platelet. Our thyme is for thymus. So a thymus cell. All right, this one we have three of them. So atherosclerosis versus arteriosclerosis versus aortostenosis. Well, let's start on this far right side, since this one has a different suffix and root. So our suffix stenosis is for narrowing, and our root or combining form aorto is for the aorta. So this is going to be narrowing of the aorta, aortostenosis. Going back to our first two words here, our suffix sclerosis is going to mean hardening. So stenosis is narrowing, sclerosis is hardening. So that's what this is right down here. Athero versus arterio. So athero means plaque. So this is going to mean hardening due to a plaque. And arterio is our combining form for artery. So this is going to be hardening of an artery. And this is typically going to be referring to a vessel as well, but it is pointing the cause or the blame to our plaque. Diapedesis versus diaphoresis. So these again are another very similar one. So dia is going to mean across or through. And then I'm drawing a blank for just a second, guys. Let's double check. All right, I didn't want to give you guys the wrong idea. So diaphoresis is going to be our word for sweating. So that is our term for sweating. All right, dyspnea versus dysphagia. So this one, we don't really have much of a suffix, just IA on this one, but nothing really on this one. So we can look at our similarities is the prefix dys. That's going to be bad or difficult. Nia, so that P is silent. Nia is going to mean breathing. Phagia is going to be swallowing. So painful breathing or swallowing. Painful or difficult breathing, painful or difficult swallowing. And then last but not least, we have rhinorrhea versus rhinorrhagia. So rhinorrhea is going to mean some type of discharge from the nose. Rhinorrhagia is going to be, again, like flowing from the nose. So these are very similar, even though we have two different endings. And then go ahead and check out the Unit 3 review activity that will be posted as a way to practice a little bit more before your test besides just your vocab words.